Hello everyone, my name is Dr. Mukundkumar Pandya. I am a general surgeon from Kenya. I work in Nakuru County and Referral Hospital. That is one of the cities in Kenya, and I work as a general surgeon, and I'm involved with a lot of oncosurgical work there, and I've been recommended by my Ministry of Health to come for this fellowship in oncosurgery. Kenya has an increasing incidence of cancer. This is both attributed to improved diagnostics and increase in the disease burden. And currently we are facing challenges of screening to pick up the diseases earlier and also managing this, both because we don't have the right resources and the qualified personnel to treat these cases. And that demand has now reached a point where we are getting a lot of disease burden from cancer in Kenya. This ranges from GIT cancers, gynecological cancers, urological cancers, and many others. The areas of major concern are areas of screening, first of all, because cancer is treated much more better, and the outcomes, the curative outcomes are better when patients are diagnosed early and staged early, and then treatment can help achieve positive outcomes. What our deficiencies right now is that we have poor screening and patients present late. That is the first part. Second part is, even after we diagnose these patients, we need a team of specialists in multiple disciplines, such as the multidisciplinary teams that are required to optimally manage these patients. So we don't have the right personnel in some of this, and that is what creates challenges as well. The other thing that we don't have is accessibility. Not all patients have accessibility to chemotherapy, radiotherapy, and they need to be referred to major referral centers for the appropriate treatment. This training is extremely important for me because I work in a county referral and teaching hospital that serves about 1.2 million people, and it is the only referral center that has oncological services. I was personally also recruited for the reason that we can provide the surgical oncological treatment part of it. We also have a chemotherapy center and a recently instated radiotherapy center. So we serve a large population in the county and surrounding counties, such as the Kericho County, other western counties. So this training is of immense importance because it gives me a better capacity to go back and help and work and improve the facilities and the services that we can provide to the people in Kenya and Nakuru especially. I am now more capable and more confident in doing complex procedures. Oncological surgery is not the straightforward general surgery that we are taught in training. It requires an oncological principles that apply to the surgery, and thus this training gives me a first-hand exposure to that, and it will create a great positive impact on my return and I'm working. So, being a trainee, I had some expectations before I commenced this training, and being a surgeon, most of the training requires some hand-on exposure, some one-to-one apprenticeship with qualified and more experienced surgeons, and those expectations were mostly met because first of all, I'm doing a training where I'm on site, I'm in the facility, I get exposure by going to the theaters and the outpatient departments that manage these patients, plan their treatment, and also the surgical treatment that is offered. I get a first-hand exposure to it, and with teaching, intra-op teaching, and also during the follow-up of these patients. So this training makes it very easy for me to see firsthand how the patients are managed, how they are operated, and how they are followed up, which is not available readily back home. Only in a very few centers it is available. The facility that I work at is also a center for postgraduate training, and we have a good number of residents that go through under us in the training. So when I go back, the first impact it will have is that my students will have a good exposure from what I will be replicating from what I've learnt here. Plus I will be able to share with them the different principles, the different theories and the different mechanisms in which oncosurgery and oncology as a whole is practiced in a high volume center as the one that I have trained in, and that will help them to and enable them to help their patients more holistically. The other thing that I will do is I will use this qualification to push for certain other systems to be placed to be put into place for oncosurgical and oncology as a whole, oncology services, such as multiple disciplinary teams where we can involve other specialists to come into the management and be involved and give the right advice for the management plan for each patient and customize it to their benefit. Surely encourage anyone who is looking forward to enroll in such a training program, and through Merck I've had this opportunity to come here and train, and I think that it is a very good medium for anyone else who wants to train. And I would advise them that at a certain level, when you have done your masters or you've done your undergrad, then you know what your capabilities are and what your objectives are. So I would always advise them to have clear objectives on what they need in their training, and they can focus on those objectives during that 1 year or the time that they have been allocated for the training, so that they can focus and get better skills and expertise around that. And while they are still going to get all the general training around a certain field that is required. So yes, have your objectives, specific objectives very clear, and make sure that you set goals for yourself and your mentors and your trainers, and that way you can have a more successful and more fulfilling training. I would like to also now thank Merck Foundation for giving me this opportunity and bringing me to a center where I could realize my training objectives. I would like to thank this institute for hosting us and giving us the opportunity to work with them, allowing us to handle their patients with them. And I would also like to thank the Ministry of Health of Kenya that has recommended me through Merck to come for this training, and I shall make sure that when I go back it has a great and big impact on my work and my patients. Thank you. Kenya.